Hey, everybody, it's Chad Campbell, Certified Functional Medicine Provider with Redesign U and Hope Family Care, and coming for our update for today with some super exciting news about testing. So just to start off as an update, we're hearing a lot of things about things getting better and that the virus is getting better and that we're on this downslope. The thing that I just ask everybody is just to remember that the media is focused on specific areas, such as New York and New Jersey and Florida and Georgia and Louisiana, which are very important places, but it doesn't necessarily mean that it's you, and it doesn't necessarily mean that it's your area. So we can't lose our common sense with this, okay? We have to be super careful and look at what's happening in our area before we make the decisions on what we're gonna do with going back into society. So please, 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 again, use your common sense, use your common sense. A lot of people believe that they had it and that they're gonna, that they can go back into that society, but just please look at your area, okay? There's a lot of studies going on right now. So now this is getting to be this exciting time with this virus because a lot of the unknowns, the studies have all been started and happening. And so now we're gonna start learning all of the good things that we can do to reduce the risks and complications of this virus. So this should be exciting for everybody. I know everybody's excited about the social re-entrance, but I'm super excited and stoked about that. We're gonna start learning how do we prevent these complications and these problems? And I want you to be excited with that as well, because that's going to be the most important thing for long term. Some of the things that they found is that it is killing men more than women. They're saying that women may have a stronger innate immune response, meaning that you women respond better when you get exposed to infections with like your coughing, your sneezing, your congestion. But is it also because us men, we just don't go get checked out? I'm a man, I shouldn't have to. And then the men are the ones who are getting really sick. They're the ones who are actually getting more sick than the women are. Okay, so this is the exciting thing that I want to talk about with the testing and with some other studies coming up. So with the testing, just as of this week, we have the ability to test the antibodies through your lab company. And I tested some about 4 days ago, and I didn't want to bring it out until I got the results back. And it is the IgG and IgM test. So what that means is that the IgM part is what's going to show up with the acute infection. And then as that infection progresses, the M falls away, and then IgG comes up to show us that you did have exposure to that. There are some problems with the testing. So just because you test positive does not mean that you're immune to the virus. It doesn't mean that you can't get the virus again, and it doesn't mean that you can't spread the virus. So this is for those of you who say, I think I had this and I want to know if I did or not. This would be a good test to consider. It would not be a good test for somebody who's coughing saying, I think I have this, I need to get the antibody tests. This wouldn't be a good test for that. They have shown in the past that people who had with SARS-1, I believe it was with SARS-1, that their antibodies were testing positive, but then those antibodies were negative 5 years out. So we don't know with this virus, with this novel COVID-19, we don't know that just because you have the antibodies doesn't necessarily mean that you will not get this again. It does not mean that you're immune to it, okay? So we have to keep that in mind with this whole social re-entrance and social distancing until we get that information back from those studies that they're doing. And they did another study actually as well that showed that these common coronaviruses that we're exposed to all of the time, that they were testing these people over a certain amount of time, and they all had the antibodies for these coronaviruses, yet they still got the infections every year. So just because they had the antibodies didn't mean that they didn't still get the virus. They still got it. So we have to keep that in our mind. I just don't want people thinking that just because you get that test, that it means that you're good to go. It just gives you the idea that, yeah, you did have this, and maybe that virus 2 months ago, or that sickness you had 2 months ago, you did actually have it. And because that is one of the most common questions that I get in our area is, I had this horrible sickness that I've never felt like I had this before a couple months ago, before we knew all of this. Could that have been it? I have no idea. Maybe. But this thing is so moving and dynamic, and it's changing all the time. They're now even saying that the virus on the East Coast looks like it's different than the virus on the West Coast. I have no idea. This virus is, depending on who you want to follow, viruses doing things that normal viruses don't do. So the experts are trying to learn that, and I am trying to just bring you those facts so that you can make the decisions off of what you want to do with this. The masks, we just have to accept masks are going to become part of our normal routine. When this thing came out, and all these other countries, like in China, that get exposed to weird things like SARS and MERS, they get exposed to these weird things. First thing they did was put on their masks. So with your masks, keep them, okay? Because they are going to become part of our normal life. When we get these virus outbreaks, when we get these things starting to come back, flu starting to come back, you're going to want to grab your masks now. And we are going to now know that as part of our lives, just like people in other countries have as well. There are still many studies happening on medications. When is hydroxy sometime to give? Zithromycin has kind of fallen by the side now because it's an antibiotic, and this is a virus, and antibiotics don't get rid of viruses. But there are still some studies going on with the azithromycin, still the studies going on with the interleukin-6 to work on the immune system. There's even studies going on now showing that many of these people had heartburn, and that those who were on Pepcid had a much lower rate of death than those who were on omeprazole. And so they're doing studies on that now. Now, these studies that they're doing on this Pepcid, they're given 6 times, 9 times higher the amount of what is the normal dose. So don't go buying Pepcid like everybody went and tried to get hydroxy and azithromycin. Don't buy it yet. Wait for all these studies to come out, because nothing is known. Nothing is known yet. But they have shown that people who are getting this, that when we're talking about this whole ACE2 receptor in the lungs, that are in the lungs or in the guts and these different areas, and also possibly causing a lot of these neurological symptoms, that this thing may be causing more of just an overload of oxidative stress. And this would tie in with omeprazole being an increased risk as well, because when we talk about oxidative stress is this huge inflammatory response that happens in our body that creates all this inflammation. And with the ACE2 being involved, that ACE2 has a lot to do with the endothelial part and the balance of the oxidative stress. So if that is something that comes to play, then some of the recommendations that we've been talking about would definitely be super important as far as anti-inflammatory diets. Staying away from the processed foods, decreasing the alcohol, the exercise being moderate exercise, which I'm going to talk about in a second, because we want to decrease that inflammatory load, because that oxidative stress is one of the things which is increasing the risk of the pneumonias, the blood clots that you're hearing, as well as that endothelial or the blood vessel inflammation, which is throwing small little clots to the fingers and the toes, and the increased risk for the heart attacks, increased risk for the strokes. And I'm going to be talking about that endothelial inflammation and that oxidative stress on the next update, the next webinar, so that we can go a little bit deeper into that and give you a little bit better insight. For exercise and activity during all of this, I saw some things out where some people posted they've lost 30 pounds in the last month and a half because that's all they're doing is exercising. Okay, so that's not very good. Okay, that's going to be bad because you're putting a lot of oxidative stress on your body, which means that you're not going to be able to heal very well when you get exposed to these kind of things. So when we talk about exercise during this time, we want you to do some weight training. You can do some HIIT training as long as you're taking a couple days off. Do not continue to do HIIT training every day or CrossFit every day. People may come at me, but do not do it because you have to allow your body to recover so that if you get exposed to something, that your body is able to recover from that as well. So a daily walk, yoga, HIIT training every 3 days, proper eating, proper sleeping, decreasing the alcohol, and trying an anti-inflammatory diet. Again, they keep asking me, and it's in the last video, probably the one before, what supplements do I use? And I use a gut shake, which is an overall wellness, and it's the medical food because I'm horrible at eating breakfast. So I use it for my breakfast, and it's for my gut health with autoimmune disorders. As well as my adaptogen, my vitamin D if I'm not out in the sun, and my magnesium. I believe those are my 4, yeah, and my magnesium. So those are the ones that I use. And if you have any questions, just send me comments. I'll be more than happy to tell you why I use what I use or which ones I'm using. That's not a problem. So activity, be careful, okay? Be smart with that. And then next time we'll be talking about this endothelial inflammation as well as this oxidative stress and just things you can do for oxidative stress to reduce your inflammatory load. And this is good for overall wellness despite COVID, just for the future. But for now, we're focusing on the COVID for now, and we can talk about the other stuff later. Again, there are multiple studies going out. If anybody would like comments, send me questions, tell me things you want me to talk about that you might be hearing that you're just confused about, or if you want me to do some details about these studies, I'd be more than happy to do it. I just want to try to give you some quick facts. I don't want to bore you with nerd stuff of what I'm following and the stuff that I'm diving into, but if you guys want to know, I'd be more than happy to tell you. So the most important things, remember social distancing, common sense. Just because the media says we're on a down spiral, look at your area. The people in Georgia, the people in Florida, y'all are going up and down. I don't know how to give you the right answers for this right now. The people in Kentucky, kind of based right now, West Virginia, y'all seem to be doing great over there right now. The people in the Northeast that are watching, I'm glad that you guys have hit your peak, but there's the thoughts of the second wave, the third wave. Are they going to be more serious than the first? And if it follows normal viruses, should not be, but nobody knows. And we won't know until it hits, until a second virus hits, or until the second wave hits, excuse me. So common sense, okay? So any questions, comments, please send them to us. Please share so that we can get this facts to your friends as well. And I'm looking forward to talking to you next time on oxidative stress and inflammation reduction.